If we go down from the neck region, going down, 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 down. So this is the cervical 7 or C7. And this is the T1, thoracic 1. And between them we can feel clear depression here. I am coming to the cervical 7. If I go up, again I can feel the depression. And this is the depression between C6 and C7. If I go down, this is a thoracic 1. If from the thoracic 1, if I go down, I can feel again depression. So this is the depression between thoracic 1 and thoracic 2. So this is one depression, this is one depression, and this is one depression. So one depression between C6, C7. Next is C7, T1. Next is T1 to T2. So if you insert a needle between T1 to T2, this is the treatment of cervical spine. If you insert a needle between this C7 and T1, this is the treatment of thoracic spine. And if you insert a needle between C7 and C6, this is the treatment of lumbar spine. Just one needle for lumbar, just one needle for thoracic, and just one needle for cervical. She is suffering with the pain in the shoulder region and neck region. So we are focusing on the cervical spine. So from here, if we go down, 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 so we can see this protrusion. This protrusion because of this junction of C7 and T1. So because of swelling, we have to try to feel. Can you turn a little more? Yeah. Okay, enough. So we can see the clear depression here. This is C7 and this is T1. If we insert a needle between C7 and T1, this is treatment of thoracic spine. But we want to treat the cervical spine, which is down. So if we insert a needle between T1 to T2, this depression, because this is T2. So this is the treatment of cervical spine. So between thoracic 2 and thoracic 1, it is cervical. Between thoracic 1 and cervical 7, this is thoracic. And if we go between cervical 6 and 7, this is lumbar spine. So we have inverted spine here. So I want to treat the cervical spine, so I will put needle between T1, T2. So I will push the points, relax the muscle, and put the needle. My needle is going horizontally. Okay? Okay, relax. Now I can do little manipulation. I can do little manipulation. Needle should be little longer. Double means two, but I don't have this time. So I am pushing and manipulating the needle.
It doesn't touch the spine, right?
Yeah.
It touches the spine? No.
What?
It touches the spine?
No, just yeah.
the muscle.
Yeah, on the muscles only. Because I am between two thoracic vertebrae, just on the level of disc. That's it. Relax. We want to treat the thoracic spine. So now see, for treating the thoracic spine, we will insert the needle between C7 T1. So this is the point. Between C7 and T1, our needle is going like this horizontally, and we can do manipulation in that way. Bring me one more needle. So I will put one more needle for the cervical spine. So if we for lumbar spine, so between the C6 and C7, we will feel the depression again here, and put the needle in between this. This is the lumbar spine. So this is the treatment. So we have treated full spine just by 3 needles. That's